How far will you go? When a little girl's heart has trouble beating. When a family who needs quality care can't afford it. When a whole health system is feeling under the weather and a chronic disease threatens millions. How far could we go? If we put our egos aside and put our ideas on the table, if we pushed the boundaries of technology, shared our research, worked outside of silos and across borders, if we partnered with each other, if we listened to our collective minds and hearts. The fact is, there's only one way to take the world of healthcare further. And that's together. How far will you go to help change the world of healthcare? Medtronic. Further together.
Thank you for participating in the Medtronic evaluation for the CapnoStream 35. The information that you're providing us is integral to our product development. It's important that when you utilize the product, please complete the surveys. The main purpose for this is that we can get individualized feedback that, again, can assist us with launching this product. This video is created as an online training resource to prepare you for the evaluation that will be occurring in the next upcoming weeks. It will provide you with how to connect the sample lines and pulse oximetry probes to the device, how you deploy it to the patients, and the integral parts of the CapnoStream 35 that you need to utilize for this evaluation.
The CapnoStream 35 portable respiratory monitor combines Nellcore pulse oximetry and microstream capnography technology to provide accurate SpO2, end-tidal CO2 and respiration rate values with crisp waveform readings for a wide range of patients, from neonates to adults, whether intubated or non-intubated. You can use the monitor in diverse settings, including at the bedside in the hospital, while transporting a patient within the hospital, and during ground and air transport. The CapnoStream 35 portable respiratory monitor measures 4 key parameters to help you assess your patient's condition: end-tidal carbon dioxide, or the level of carbon dioxide in exhaled breath, respiratory rate, oxygen saturation, and pulse rate. It incorporates microstream technology to provide you with a highly accurate view of the patient's ventilation adequacy, and Nellcore pulse oximetry technology to measure blood oxygen saturation, even when your patient is moving or poorly perfused. The first of these algorithms is the Integrated Pulmonary Index, or IPI. The IPI integrates all 4 real-time respiratory parameters into a single number on a scale from 1 to 10. IPI is helpful in busy clinical environments and makes it easier for clinicians to monitor and manage ventilation and oxygenation by providing an integrated snapshot of a patient's respiratory status. The IPI algorithm promotes early awareness of changes to respiratory status. The front panel of the CapnoStream 35 portable respiratory monitor features a brightly coloured, easy-to-read display screen, power and navigation buttons, plus status indicator lights. These include on-off, battery power, medium priority alarm, high priority alarm, ambient light sensor, back button, home button, menu button, alarm silence, enter button, and directional arrows. On the monitor's right panel, you'll find connector ports for the microstream CO2 sampling line, gas outlet, SD card, and 12-volt DC connector for the AC adapter. The left panel has connector ports for the Nellcore pulse oximetry sensor, USB flash drive, and mini USB for technician access. The back panel includes a connector port for optional accessories such as a communications unit, and a panel with device information and serial number. Under normal conditions, The monitor's internal battery provides power for up to 20 minutes. In addition, the bottom panel houses a hot swappable battery pack that can provide power for up to 3 hours. To navigate the monitor's display screen, use the arrows to move up, down and across the screen and press the Enter button to make your selection. Use the arrows and Enter button to input letters and numbers when prompted by the cursor. To turn on the monitor, press the On/Off button on the front panel. The display screen will light up. The default home screen includes CO2 and SpO2 waveforms. However, there are 9 different screen display options to choose from. Use the left and right directional arrows to toggle through options. To see all 9 home screen options and instructions on changing the default home screen, consult the operator's manual. To operate the CapnoStream 35 portable respiratory monitor, connect the AC adapter to the 12-volt DC port on the monitor's right panel, attach the power cord to the AC adapter and plug the cord into an external power source. The battery power indicator on the front of the monitor indicates the battery and power status. The indicator is green when the monitor is connected to AC power and both the internal battery and the battery pack are fully charged. The indicator is orange when the monitor is connected to AC power and one or both batteries are currently being charged. Before you turn on the monitor, connect the Nellcore pulse oximetry sensor cable and/or the patient-appropriate MicroStream capnography sampling line to the appropriate port on the monitor's side panels. For accurate respiration monitoring, it's important to properly classify your patient. The monitor recognizes 5 different patient types, but the default setting is for adult. To change the patient type, press the Menu button on the front panel and use the directional arrows to navigate to the Patient Type drop-down menu in the top left corner of the screen. Using the up-down directional arrows, select the appropriate patient type from the list and press Enter. If you are prompted to confirm, press Enter again. Each patient use should be recorded as a new patient case. To establish a patient case, press the Menu button and navigate to Actions, Patient Admit. The monitor will automatically generate a patient ID number, which you may change to suit your unit or facility. Next, input your patient data and then navigate to and press the Start Case button on the left side of the screen. A window will notify you that a case has been started, and the button will now read Stop Case. When a case is complete, navigate to this same window and press the Stop Case button. It's often useful to have a record of patient events, such as taking medication, patient activity, or clinical interventions that may have influenced recorded measurements. To add patient events to the record, press the Menu button and navigate to Actions, Events, or press and hold the Menu button to arrive at the Events screen. Press Enter and the medication screen will appear. Select the medication and press Enter. Additional event options appear to the left of the screen, including text entry, PaCO2, patient, and intervention. You can use the text entry option to add up to 20 characters of text, plus the date and time of the event. After recording the event or events, press Enter to return to the home screen. If you decide not to input event data, press the Back or Home buttons to return to the home screen. If no screen options are selected for 60 seconds, the monitor will automatically return to the home screen. For accurate, reliable Nellcore pulse oximetry and MicroStream capnography measurements, you can count on Medtronic patient monitoring technologies. For more information about the technologies built into the CapnoStream 35 portable respiratory monitor, please visit medtronic.com/Covidian/products.
Capnography is a non-invasive, continuous measurement of exhaled carbon dioxide concentration over time, or end-tidal CO2. With MicroStream filter line sampling lines, oxygen is delivered in a cloud from small pinholes around the mouth and nose, ensuring oxygen is being delivered without diluting the readings or waveforms. The patented unijunction technology permits upward or downward pressure of the breath at the junction, allowing only that source of breath with the greatest pressure to be sampled. This enables better sampling to capture both nasal and mouth breathers. Dual Nair sampling combined with the oral scoop or unijunction technology provides accurate oral and nasal sampling through the MicroStream filter lines. MicroStream technology uses revolutionary detection technology to sample CO2. The unique molecular correlation spectroscopy uses a CO2-specific infrared wavelength that is unaffected by the presence of other gases, such as oxygen, nitrogen, helium, or inhaled anesthetics. Therefore, no individual patient calibration is required. In addition, the small sample size of 50 milliliters per minute is adequate for all patient populations and is designed to meet the small sample requirements of neonates. MicroStream technology provides a single, simple solution for ventilation monitoring by measuring the CO2 gas in the entire respiratory cycle, helping to improve patient safety across the continuum of care.
A sampling line captures the exhaled breath sample from the patient's nose or mouth and sends it to the capnography monitor to measure ventilation adequacy. The pulse oximetry sensor provides an indication of the amount of oxygen in the blood. The monitor also calculates the patient's respiration rate and heart rate. All these measurements combined give clinicians a complete picture of a patient's respiratory status. So, how does it work? Let's watch capnography monitoring in action. Here are my healthy values. Now let's see what happens when I stop breathing. When a patient stops breathing, or if breathing is compromised, the normal exchange of gas in the alveoli of the lungs is disrupted. Capnography and pulse oximetry monitoring measure this exchange of gas in the alveoli. And I'm back. As we've just seen, the MicroStream capnography monitor provided an early indication that my breathing was compromised. Capnography and pulse oximetry are both important measurements and, when used together, provide clinicians with a complete picture of a patient's evolving respiratory status. This is critical because early detection of respiratory compromise can lead to earlier intervention by clinicians and improved patient outcomes. Because patient safety is vital, MicroStream capnography matters. To learn more about the MicroStream technology advantage, visit our website and watch the video about respiratory compromise.
It's important to note that CO2 plays a role in metabolic, cardiovascular, and respiratory systems. By monitoring CO2 concentration, the clinician has an indication of subtle pathological disturbances of metabolic, cardiovascular, and respiratory systems. End-tidal carbon dioxide represents the concentration of CO2 in the exhaled breath at the end of expiration of a normal tidal volume, or the end tidal breath, and thus is a measure of ventilation. The normal range for end-tidal CO2 is between 35 to 45 millimeters of mercury. Capnography monitors CO2 removal during breathing and provides a breath-by-breath assessment of the patient's ventilatory status. Although the numeric end-tidal CO2 value is important, the waveform is equally as important. The time-based waveform is a graphic tracing of the inhaled and exhaled partial pressure of CO2 millimeters of mercury during each respiratory cycle plotted against time. The waveform changes immediately when there is a change in breathing, and it is the first sign of a respiratory problem. During phase 1, also known as AB, gas is exhaled from the large conducting airways, which contain essentially no carbon dioxide. The exhalation cycle begins with air leaving the trachea, posterior pharynx, mouth, and nose. This is called dead space because no gas exchange occurs. Identified as the first upward deviation from baseline, dead space is rapidly flush of empty air from the upper airway and replaced with CO2-rich air from the lower airway. As the CO2 concentration increases, the amplitude of the waveform concurrently increases. In phase 2, also known as BC, the ascending phase, CO2 from the alveoli begins to reach the upper airway and mix with the dead space air. This causes a rapid rise in the amount of CO2, and it is now detected in exhaled air. Identified as the gradual upslope of the horizontal line between the end of phase 1 and the beginning of inhalation, or phase 3, of the respiratory cycle. During phase 3 also, the carbon dioxide concentration curve remains relatively constant. As primarily alveolar gas is exhaled, this is known as the alveolar plateau. The end of phase 3, also known as D, is the end of exhalation. The end of the breath cycle contains the highest concentration of CO2, which is labeled the end tidal CO2. This is the number seen on the monitor. End of phase 3 shows the end of exhalation, the end tidal CO2. At phase 0, also known as DE, inhalation will begin. Oxygen fills the airway and CO2 levels drop back to zero, identified as the rapid descent at the end of the respiratory cycle. When inspiration does begin again, the amount of measured CO2 quickly drops to zero. The return to baseline is called phase 0. Capnography trending provides important information in an acute asthma exacerbation. In a patient with asthma who is well, controlled on medications and not having an attack, the end tidal CO2 readings will be normal, between 35 and 45 millimeters of mercury, and the waveform will appear normal. During a mild asthma attack, the patient's respiratory rate increases to compensate for the bronchospasm and to maintain oxygen saturation. This hyperventilation can cause a drop in the end tidal CO2. The waveform will be curved, and wheezing can be heard upon auscultation of the lungs. In a moderate asthma attack, when the patient begins to tire, the end tidal CO2 gradually returns to the normal range. The waveform remains curved, and the patient continues to wheeze. This represents the patient tiring after maintaining a high respiratory rate for an extended period without relief from treatment. As the respiratory muscles begin to fail, the respiratory rate slows down and the end tidal CO2 may rise. In a severe asthma attack, a curved waveform is present, and the lung exam reveals either wheezing or a quiet chest, and the end tidal CO2 may rise above normal levels or begin to fall to low levels. This is a medical emergency as intubation of the asthma patient does little to relieve their bronchospasm. By using capnography during an asthma attack, you obtain ongoing, objective, important trending information that helps you more effectively manage the patient. Alcohol is a central nervous system depressant, and when taken in excess, alone or in combination with sedative drugs, can cause severe hypoventilation, progressing to respiratory failure. When a patient is obtunded or unconscious due to alcohol or drug ingestion, capnography is essential as it is the only direct, non-invasive window to evaluate the patient's ventilatory status. Capnography will monitor the patient's breathing and provide the earliest indicator of impeding respiratory failure. We will now discuss capnography for airway placement, ventilation, and CPR effectiveness. Applications for the use of capnography in the intubated patient include the following: verification of an initial endotracheal tube placement, continuous monitoring of ETT placement, monitoring during non-invasive ventilation, monitoring cardiac output during cardiac arrest and CPR, monitoring with alternative airways, and monitoring with CPR threshold devices. When verifying proper placement of an endotracheal tube or supraglottic device, it is essential to recognize that traditional clinical indicators of placement can be unreliable. This includes fogging or condensation of the endotracheal tube or supraglottic, breath sounds heard over the stomach and chest wall movement. Capnography is the most reliable non-invasive means of confirming endotracheal tube placement and supraglottic placement because it provides accurate and objective information based on continuous monitoring of the airway. The ability to safely and effectively manage the airway is among the most fundamental and challenging aspects of EMS. Maintaining the integrity of the airway while providing oxygenation to the brain is critical to a successful outcome. Various techniques and a wide array of airway devices are available to EMS personnel. With effective cardiac compressions, cardiac output is increased maximally to 1/3 of normal output. The change in cardiac output with effective compressions is reflected in an increase in the end-tidal CO2 from the baseline. End-tidal CO2, therefore, can be used to assess the depth, rate, and force of chest compressions. After airway and breathing have been secured, capnography can be used to assess perfusion. Capnography during CPR can be used to gauge the effectiveness of chest compressions. Increases in end-tidal CO2 have been shown to correlate with a fresh rescuer at a faster compression rate, a new rescuer during CPR with no change in rate and mechanical compressions. Therefore, better compressions lead to higher end-tidal CO2 levels and improved perfusion. Capnography's value in monitoring the effectiveness of compressions during cardiac arrest is well documented in literature. End-tidal CO2 levels can be used to detect the return of spontaneous circulation during CPR. If medications and shock treatments are successful in returning the heart to a normal rhythm, the earliest indicator of this change will be an increasing end-tidal CO2 level from the baseline. As the cardiac output increases, it is immediately reflected in a rise of the end-tidal CO2. During cardiac arrest, CO2 is still being produced at very low levels by metabolism. This causes CO2 to build up in the blood because there is inadequate perfusion transporting it back to the lungs to be exhaled. Once the heart is pumping effectively and the cardiac output increases, a large bolus of CO2 is transported back to the lungs and appears on the CO2 monitor as a significant rise in the end-tidal CO2. This rise in end-tidal CO2 generally occurs within 30 seconds of the return of spontaneous circulation, before detection of a pulse or a palpable blood pressure. Pulse detection may be further delayed if significant arterial vasoconstriction is present. In summary, measuring carbon dioxide concentration in a patient's exhaled breath indicates a patient's adequacy of ventilation. Along with respiration rate and pulse rate, capnography is instrumental in monitoring patients during CPR and emergency cardiovascular interventions. Clinical societies like the American Heart Association updated their guidelines to recommend the use of capnography for confirming endotracheal tube placement, monitoring CPR quality, and the detection of return of spontaneous circulation. Capnography provides clinicians with material information for indications of respiratory distress or depression.
Thank you for completing the CapnoStream 35 evaluation training video. We will be setting up training stations at each of the individual fire and EMS stations for you to get hands-on practice prior to placing this on patients. Once you put the patient on the product, we ask that you complete the survey information either online or in hard copy format so that we can get your valuable information. Thank you again for participating in the CapnoStream 35 evaluation. Have a great day.